Hi everyone, this is Pili Queja with the Alaska After School Network, and I'm going to talk to you guys about the Learning About COVID-19 Activity Guide. So, once again, just to say thank you for joining this tutorial. This guide was compiled by after-school care professionals from all over the United States who saw a need to continue providing high-quality programming during a challenging time for our youth and the families that we support. So I really hope that this guide will provide activities for you and your teams as you continue planning programming. And if COVID-19 has taught us anything, it's that after school programming and the people providing care and guidance to the youth of America is essential. So thank you for everything that you're doing. Objectives of this training are that we want to make sure that we'll give you the opportunity to learn more about this resource, which is the COVID-19 activity guide. We also want to make sure that you'll have help with implementing the activity guide. So we're going to go over a couple of tips and tricks about the guide. And also we want to make sure that we can help build staff confidence in speaking with youth about COVID-19. So before we get into the training guide, I think it's really important that we address our role in stopping the spread of germs and the virus in COVID-19. So we all have an impact on how the virus is spread, as well as stopping the spread. So what you can do to help stop the spread of the germs and COVID-19 in our programs is that when we have people around, to keep a physical distance of at least 6 feet, to make sure that you cover your mouth whenever you have a cough or a sneeze. Also, whenever we're in public, making sure that we wear a mask that covers our nose and our mouth. Other things we can do is try to refrain from touching your eyes, your nose, and your mouth with your hands. Also making sure to clean and disinfect any of our areas that have high contact. Washing our hands with warm soap and water, and also making sure we stay home when we're sick. All of these guidelines are things that are been pushed out by the CDC. So we want to make sure that we try to use that the best we can so that we can stop the spread of germs and stop the spread of this virus. So we know that these are the different regulations that the CDC would like us to follow right now while we fight COVID-19 during this pandemic. But what we really want to focus on is what does this mean for our students? So as youth are having to focus on being physically distant, they're spending a large amount of time at home. And youth are also online in different platforms more than probably ever. So what we want to think about is that when youth are engaging in these online platforms, they're able to see a huge amount of information. They're able to Google just about anything that they would like and be able to get a lot of different information. So what we want to do is we want to make sure that we can give them the tools and resources to be informed about this virus. And that's where the COVID-19 activity guide really does come in. So overall in after school, we want to make sure that we're going to use our resources to help reduce stigma, so that we can also help to foster empathy, that we can increase youth resilience and stop the spread of the virus. So when we're talking specifically about stigma, we're talking about this discrimination against an identifiable group of people, a place, or a nation. So this is when we start to take the virus away from what the actual enemy would be. So we start to put different blames or different generalizations on people, and we start to become what's the word? Discriminatory towards specific people group just based off of our assumptions. So this really does come from a lack of knowledge about COVID-19, really about a need to feel as though you need to blame somebody for why we're all experiencing this virus right now. Also having a lot of fear and anger around this virus. What we start to see is that that anger or that stigma is really experienced by specific groups of people, right? So we have people who might experience it more than others. So typically we have a longer list here, but we have people such as our emergent responders or healthcare providers, anybody who might have tested positive for COVID-19 after they've recovered from being sick or were being released from COVID-19 quarantine, they might experience stigma. And just a generalization of maybe they weren't following CDC guidelines or all these different things, but those aren't really necessarily true. We want to make sure that we are doing everything that we can to follow CDC guidelines, but that doesn't guarantee that we won't contract the virus. Also, certain racial and ethnic minority groups, such as Asian Americans, Pacific Islanders, and Black or even African American groups. Those are the people that we see most impacted by the stigma around COVID-19. So what we need to make sure that we do is that we educate youth on reducing the stigma for COVID-19. And what we want to make sure we talk to them about is that there's really no single person or group of people that are more likely than others to spread COVID-19. And this stigma really hurts everyone by creating more fear and anger toward ordinary people instead of just focusing on the disease that is causing the problem. Here in Alaska, we have one of our doctors named Dr. Ann Zink, and one of the quotes that she likes to use is that the people are not the enemy. The virus is the enemy. We need to focus our attention and our efforts towards fighting the virus and less time on fighting people. So that's a big piece of us reducing that stigma. And the other ways we'll see that, and this is actually supported by our COVID-19 guide, is that we want to make sure that we correct all of the negative language that can actually cause the stigma. So some of the things we need to focus on are using things such as the actual scientific terms, making sure that youth understand how a virus spreads, understanding why it's important to wear masks and why that has a big piece of empathy, and what we can do as people to really help that. Which leads to my next slide, which is empathy is very important right now. It's essential for us to be able to think about empathy in terms of we want to be able for youth to be able to think about how their actions impact others, and they need to start thinking about what other people might be going through in their lives, and be able to then share those same emotions and understand why it's so important that we wear our masks. A lot of the times, the CDC has pushed out some guidelines regarding masks, is that our masks are there to help us stop the spread. It's there so that we can help keep each other safe. And a huge piece of that really does resolve around empathy. I'm going to show you a quick video by Dr. Brene Brown about empathy. And this is also something, if you'd like, you could share this with your youth or with your other staff members.
So what is empathy, and why is it very different than sympathy? Empathy fuels connection. Sympathy drives disconnection. Empathy, it's very interesting. Teresa Wiseman is a nursing scholar who studied professions, very diverse professions where empathy is relevant, and came up with 4 qualities of empathy. Perspective taking, the ability to take the perspective of another person or recognize their perspective as their truth. Staying out of judgment, not easy when you enjoy it as much as most of us do. Recognizing emotion in other people and then communicating that. Empathy is feeling with people. And to me, I always think of empathy as this kind of sacred space when someone's kind of in a deep hole and they shout out from the bottom and they say, I'm stuck, it's dark, I'm overwhelmed. And then we look and we say, hey, climb down. I know what it's like down here, and you're not alone. Sympathy is, ooh, it's bad, no, you want a sandwich? Empathy is a choice, and it's a vulnerable choice, because in order to connect with you, I have to connect with something in myself that knows that feeling. Rarely, if ever, does an empathic response begin with at least. Yeah. And we do it all the time. Because you know what? Someone just shared something with us that's incredibly painful, and we're trying to silver lining it. I don't think that's a verb, but I'm using it as one. We're trying to put the silver lining around it. So, I had a miscarriage. Oh, at least you know you can get pregnant. I think my marriage is falling apart. At least you have a marriage. John's getting kicked out of school. At least Sarah is an A student. But one of the things we do sometimes in the face of very difficult conversations is we try to make things better. If I share something with you that's very difficult, I'd rather you say, I don't even know what to say right now, I'm just so glad you told me. Because the truth is, rarely can a response make something better. What makes something better is connection.
Right, so watching that video, something that I wanted to bring about too is that while we focus on youth empathy, we also need to think about how we showcase and role model that empathy for our youth. Something specifically about how do we build empathy and then not just feel like we're showing sympathy for them. Because there's going to be times when we're going through our programs right now that youth are going to be sharing some hard things with us or some difficult challenges that they're experiencing. And I think right now, especially with what's happening within our country and what's happening, is that everybody needs to come from an empathic standpoint and just understanding that sometimes it's so difficult to share what might be happening. And we're in just such a difficult transition. We're in a different time that the most important thing we can do is just be there for each other. And if we can show that to our youth, then hopefully they can start to see that role modeling and then be able to showcase that to them, to their friends, and also start to showcase that to their families. Because one thing we also want to think about is we're not just thinking about the importance of making sure that we have after school programming just so that they can learn more about science, technology, engineering, or math. There's also this huge social emotional side that's huge. And it's really powerful when we start to think about that as a powerful part of our programming. So empathy is very important to make sure that we try to do that. And the ways that we can really start to show that and really role model that for our youth is we can talk about their feelings. We can start to see, I'm sorry, it's not start to see. We can talk about their feelings and understand where they're coming from and just be grateful that they're willing to welcome us into that part of their life, and really think about how great it is that they see us as a trusted adult. We can also respect and validate their feelings, and we can also cultivate their perspective taking skills. So really allowing for them to think about, hey, if I was in that same situation, what would things be like? Or what privilege do I have that I don't even realize that I'm able to experience? Those are all huge things that we can talk about, especially as things start to go forward. We don't know what's going to happen in the next few months. We don't have certainty about what's going to happen with this virus. But what we can do is we can be there for our youth and we can support them by validating those feelings that it's okay to be afraid and it's okay to be scared. But we can also start to use this guide as a way to maybe start to educate them about some other things. So maybe they, when something comes up for them that does cause them a little bit of anxiety or starts to give them a little bit of fear, maybe they'll have a little bit more knowledge too, so they can combat that. And all this really goes towards that resiliency. When we're talking about resiliency, we're talking about a youth's ability to persevere when they're faced with something really difficult, that they're able to think about it, able to understand it, be able to be stretched by it, but also be able to move forward, and being able to face and make productive decisions when they're faced with that. So often we forget that our youth experience all of their different events in their life are very huge, large human emotions. And what we want to do is we want to help them be able to navigate those things, especially now. There's nothing easy about being in 4 or 5 hours worth of Zoom, if that's what's happening in your school districts, or not being able to go to see your friends, or not being able to travel. This took away a large part of youth summer. So even thinking about, there were some youth that might have been really excited to go on a family trip, and all of that was canceled. So really thinking about, okay, this may have happened. You may have had something difficult or challenging that you're facing, but these are some things that we can help you to help move forward. And the way we do that is we just build those really strong supportive adult relationships. We want to make sure that we can identify traits and behaviors that lead to being resilient and make sure that we practice those. And then we also make sure that we have real opportunities for productive decision making and constructive engagement. So let's get into the learning about COVID activity guide. So because we've been in this pandemic since March, we've been seeing a lot of different things happening with our program, and programs are finding really different inventive ways to connect with youth. So one of the first ways that we're seeing it is we see in-person programming. And this is really where local mandates and safety protocols allow. And these are where we're seeing a lot of our frontline workers. So really thinking about, we do have some people that are still doing in-person programming, but they are also having to follow those local mandates and also follow different safety protocols. Some programs are doing program grab and go activities. So what we're seeing here is that programs are having activities that are already pre-planned that they're going to facilitate with the youth. And actually, that's actually a variation of it too, is that sometimes it's program grab and go activities where the youth can go to a facility, grab the activity supplies necessary, and then they're able to do those activities at home. Another modification to program grab and go activities is that you're able to have the youth come pick up those materials, or you have those materials delivered, and then they're able to get onto a virtual session and do virtual programming with you, where you can then have them participate in an activity, but you're leading them along. And another ways that we've seen this is just wherever possible is that youth are just engaged fully in virtual programming. So something happening on a Zoom platform or a Go-To platform, or even on some other really great collaborative resources that are coming out. So specific for the learning about COVID activity guide is the guide is broken up into 40 different activities and challenges. The age groups that we have for this activity guide are 5 through 18, and there are 10 activities per age group. So all of these activities are actually able to be done in person, virtually, and also as take-home packets. So we're going to go to the actual activity guide, and the way that you access that is you go to the AK After School. So we have, with the Alaska After School Network, we have a resources page, which is COVID-19 resources. You click there, and you go to COVID-19 activity guide, and it's all listed right here with a quick introduction, and all the guides are listed here. So we're going to go into the guide right here. So this is what a typical layout for the activity guide will look like. At the very top, you'll see the name of the activity. This one's called Virus Detectives. You'll see an activity description. I'm going to read that for you really quickly because I don't know if you'll be able to see it on your screen. So in this health activity, you'll do a scavenger hunt to learn more about where a virus lives on surfaces in the home. This activity is designed to introduce youth to surface transmission of COVID-19. This activity also encourages the development of health literacy, inquiry, and critical thinking skills. So the supplies that you'll need are a pen, a pencil, Post-its, or virus cards or tape, and a virus scavenger hunt handout. So whenever we have a handout on the supply list, those are provided at the back. So if you scroll to the back, it's right here. Then we have all the different steps. So the COVID-19 virus is spread from one person to another through two ways. The first is through the air, through respiratory droplets. Like when someone sick coughs or breathes and someone else inhales that air or droplets land on their nose or mouth. The second way is by touching surfaces like a table that have the virus on them, and then touching our eyes or mouth. In this activity, we'll look for the surfaces in our home where germs are. So you're going to find all 6 clues on the virus scavenger handout. So you'll then navigate youth over to the virus detective handout, and they're going to look for these things in their home. So COVID-19 can live on places where people touch often. Find the doorknob that people touch the most often in your home. Or COVID-19 can live on a surface for hours, or up to several days. Find a place in your home where you think the virus could live the longest. After they find that clue, they're going to put a Post-it note or any of the virus cards or anything that you can come up with. Right here, we have some tape that this kiddo was able to get a hold of, and he was able to mark a knob. He was also able to knock a faucet, just different things that could be contaminative. So looking at this, we have adaptations to the activity. So if you're delivering the activity in person, modify the handout to find places in your building. If you're delivering the activity virtually, ask youth to do the activity before your virtual session. Discuss how the activity went and the questions for discussion during your virtual session. Also, if you wanted to build on this activity, you could have the youth draw a map of the inside of your home and label each room like kitchen or bedroom and mark the spots on your map. You could also have them create signs to remind you and the people you live with to wash their hands. Some of the helpful things is that when we were talking about this in my introduction, we wanted to talk about really building your confidence and leading these type of activities with your youth. And that's where this questions for discussion piece comes in. So within questions for discussion, you have what surprised you to learn about viruses that could be in your home, or what are the ways that you can keep the surfaces in your home clean? So sometimes it's difficult to generate questions, especially open-ended questions, if you're not familiar with the specific subject content. So we wanted to make sure that we could provide a resource for you there. Another one that I think is super helpful is the facts for staff and family. So the COVID-19 virus is spread from one person to another through two ways. The first is through the air, like when someone's sick, coughs, or breathes, and someone else breathes in that air. The second way is by touching surfaces, like a table that have the virus on them, and then touching our eyes or mouth. So all of the activities that are in this guide feature facts and staff for families. So whatever you need to do, you are actually going to be able to provide them with that information. So also, what I said earlier is that the activity guide covers from ages 5 through 18. So all of the activities are not the exact same when you go through all the different age groups. So for this specific activity, this is called Virus Detectives. And this one, as we went over, really is about finding viruses in your home. This next one is called the Calm Down Path. And this one really is teaching youth. So in this social and emotional learning activity, youth will create a calm down path. As part of the COVID-19 unit, this activity is designed to teach youth the steps they can use to manage their emotions when they are exposed to potentially frightening media about the virus. This activity supports the development of self-awareness and self-management skills. Okay? So that's an example of something that we're using to help build resilience in our young people when we're working in this activity. And as I said before, all the activities are not the same. So I'm going to show you what this looks like as we go up to the older age group. So this is an example of the 5 through 9s. This is a 13 through 15. So as I showed you before in that virus detective activity, in the 13 through 15 age group, the activity is actually called disease detective. So in this activity, youth will help to solve a public health mystery using clues. This activity is designed to introduce youth to careers in public health and epidemiology, which is a study of how diseases affect a population. This activity encourages development of health literacy, inquiry, and critical thinking skills. So rather than just educating youth about where to find the viruses in their home, in this one, we're actually talking about the STEM career associated with that competency or with that ability to locate where that virus might be. Then, if we go a little farther up, rather than having an activity like the Calm Down Path, which is where youth were building that map, we have a personal stress plan that the youth will be able to work through. So in this social and emotional learning activity, youth will reflect on the emotions they have experienced during the pandemic and create a personal stress plan to identify actions they can take to help manage their emotions. As part of the COVID-19 unit, this activity is designed to help youth identify stressors and build positive coping skills. This activity supports the development of self-awareness and self-management skills. So this is something a little bit different where we're really wanting them to build those skills and we help them build a plan, which is basically very similar to the Calm Down Path, but we're also wanting to make sure that we can talk to youth at their level. And just like before, this activity contains the handouts that are necessary for it, as well as some facts for the youth. and also a lot of questions for discussion, so that way we can have those resources available. So if you have any questions, go ahead and reach out to us at the Alaska After School Network. And if there are none other, I hope you guys have a great conference, and I hope that you guys were able to use this resource to your advantage. Thank you.